Hi, I'm Dr. Vijay Shetty. I'm an orthopedic surgeon with a special interest in advanced hip and knee surgery. I am a full-time orthopedic surgeon at the Dr. LH Hiranandani Hospital, Powai, Mumbai. I'm primarily a hip and knee surgeon, so large bulk of my practice involves joint replacement, mainly the hip and the knee. This is a nearly $20 billion industry globally, and it's picking up every year. Worldwide, more than 1 million knee replacements are done every year. In India alone, it's around 150,000 knees per year. So it's growing every year. It is expected to reach almost about 300,000 knees in 2022. This is a huge market, and the business is going strong, and it is going to stay for at least another 15-20 years, as other options of treating joint arthritis are not picking up so fast. Frankly speaking, I don't see any difference. The materials are same, the designs are same, and the performance on the long run. The only problem that we have at this point is that we don't have solid scientific evidence and on the Indian implants yet. The imported implants carry about 25 to 30 years of their existence in the literature. So that is the only downside. I think in the last 10 years or so, joint replace has gone to a different high. There are issues with the designs, there are issues with materials and the technology. The design-wise, these days we have implants that give almost full range of movements as in normal knee. When it comes to the materials, we were used to tell our patients that these implants last for about 20 years, but now we have materials that last almost for about 30 to 35 years. That is a big advancement. And when it comes to technology and the cost, I think cost has come down as the government of India has capped on the implant. So it's more or less the same whether you use Indian or imported implant. The technology has further gone up with the use of computer-assisted surgery and robotic-assisted surgery. HOME stands for Hiranandani Orthopedic Medical Education. This was a concept that we conceived about 10 years ago. This is part of the academic department of orthopedics orthopedics at the Dr. LH Hiranandani Hospital. The purpose is to focus mainly on academic research, clinical research, and animal studies. We have over 200 publications under the banner of HOME. And HOME offers international fellowships which are recognized by CCOT, which is the largest orthopedic organization in the world. AutoBiologics is a division that falls under the umbrella of orthopedics. This is a treatment option that involves orthobiologics, in the sense the products from our own body. These products involve platelet-rich plasma, stem cells, and cartilage cells. So this is mainly a branch that involves regenerative therapy in orthopedic clinical practice. So we started this in our institution about 9 years ago, and we are arguably the first institution in the country that started orthobiologic therapy in orthopedic clinical practice. We have also set up the Indian Biologic Orthopedic Society, which is based out of our hospital. Sports medicine at one time in India was very hardly heard about, but of late, in the last 5 to 7 years, we have been doing quite a lot of work in sports medicine, and I can confidently tell you, as the Vice President of Indian Association of Sports Medicine, that most of our elite athletes now do not go abroad. They get their treatments done in India.